Good evening, everyone, and very warm welcome for today's Med Talk Digital CME session. I am Adafshin, your moderator for this special session. On the occasion of World Suicide Prevention Day, we are addressing that topic that is not just medical but deeply human from sadness to suicide break the silence. Every year, millions silently suffer from depression, anxiety, and emotional pain that too often goes unspoken. As healthcare professionals, breaking this silence is our collective responsibility to listen, to identify early warning signs, and to offer hope. It is my honor to introduce for today's speaker Dr. Ranjan Bhattacharya. Let me share some of his achievements. He did MD, DNB, Psychiatry from MNAMS. He is a professor, Department of Psychiatry, Bankura Sammilani Medical College in India. He is director, Charak Square Diagnostic Research Center. He is visiting consultant at Ruby General Hospital and Medica Super Specialty Hospital and Narayan Memorial Hospital and Remedy Medical Services Private Limited. With decades experience, Dr. Bhattacharya at the forefront of mental health care, combining academic excellence with compassionate clinical practice. Today he will guide us through the complexities of suicide prevention, helping us understand how to move from silence to support. Dr. Bhattacharya, we are truly privileged to have you with us today. The session is yours now. You can continue.
Thank you, Ada, for your wonderful gesture and kind interaction. So, I'm a huge respect to Dr. KK Agarwal, and it's my privilege and honor that IGCP team has invited me to have this Med Talks. Today is a very auspicious day, as we all know. We call it, it is the World Suicide Prevention Day, and 10th September in every year since 2003, we are observing this day in collaboration with the International Association for the Suicide Prevention, World Health Organizations, and the World Federation of Mental Health. So this is a day where we generate the awareness among the common people. There are many myths that suicide is done by the weaker personality and suicidal patients are always suicidal. So there are many things to break, and breaking the barriers of the stigma is a daunting and huge task by the psychiatrist. From the very inception, the psychiatry, when it was termed by the Johann Christian Real, it has been stigmatized. So today, the magnitude of the problem is very, very serious, as we all know. So magnitude of the problem is such serious that in every 3 seconds in world, someone is attempting suicide, and in every 40 seconds, that means in every 13 attempts, one person is successfully culminating to the suicide. In the year 2019, there had been 8 lakh people worldwide had committed suicide. In 2023, the statistics was that 7.2 lakh people has committed suicide worldwide. In India, the scenario is that the data is being retrieved from the NCRB, that is the National Crime Record Bureau, where you get that almost the 1.5 lakh people out of the 143 crore population in India have been died due to the suicide. So, what is suicide? It is an attempt to solve a problem with an intense emotional pain and impaired problem solving skill, L defined by the Calafat and Underwood in the year 1989. So, it's an act of self harm. It's a permanent solution to a temporary problem. So, once suicide is being committed successfully, it never remains treatable. So, suicide in true sense is 100% preventable. But there are signs that when the person is going to commit suicide, we have to be very vigilant for that. There are risk factors including the discriminations, exposure, current present stressor, which eventually leading to the trigger factor of this committing suicide. The family dynamics is very important, and most important part is that everything lies in genetics. So suicide also run in families. We have seen that in the three generation, around 11 people of the Ernest Hemingway family had committed suicide. And there had been genes related to the 5-HPL transporter, which had been linked and reduced risk of reduced level of the 5-HIAA, that is 5-hydroxy acetic acid in the cerebrospinal fluid, had led to the suicide. Access to means is very important. How the firearms are available, how the organophosphorus is available, how easily it is available to procure the sedative group of drug from a chemist shop. These are the very, very important triggering factor that is leading to the suicide. So very, very important to have this. So in my presentation, I will highlight about the epidemiology, the risk assessment, emergency care, legal duties, media ethics, psychological autopsy. And I have no conflicts of interest. The platform by IGCP has been kind enough to invite me, and I am just delivering these statistics in the year. You will find in 2024, just previous year, the national rate stood 12.4 per lakh population. So we calculate the prevalence of the suicide is by the 1 lakh population. So per 1 lakh population, 12.4 persons are committing suicide, and of this, male is around 12 and female is around 9. So this has been reduced to 9.87, and this data has been changed over the last 10 years. So there has been 40% decline of the suicidal completed suicide in India. That's a good sign, but still there are spats of incidents where it is increasing, and I'll highlight on that presentation. It is the third most commonest cause in the 15 to 29 years, but in the adolescent population, 10 to 19 years, so in India has been emerged as a leader. So it's the number one country when it is considered with adolescent suicide globally. It does not occur in the high income country. Only 27% of the developed country people are committing suicide. The LAMIC country, that is the SAER, Southeast Asian region, and the LAMIC, there is a low and middle income country. 73% suicide occurs here in India, Pakistan, Bangladesh, Myanmar in the Southeastern Asian region, and the Sub-Saharan Africa. So very important to find out what is the reason in this population. If you go with the statistics in India, you can see that in Chhattisgarh it ranges 26.9 per lakh population to Jammu and Kashmir 1.6 per lakh population. Religion prevents the suicide. So the person when become more religious, who are doing the religious rituals, they are less likely to prone to commit suicide. So this is a beautiful graph. What are the triggering factor? How suicide impulses comes and go. If you go with the middle dancing figure, you can see there are many factors. One is genetic factor, environmental factor, social factor. All this has been leading to the suicidal risk and behavior, and eventually this triggering factor, economic loss. What are the two important causes of the suicide in adolescence? Are number one, breakup in relationship, and second one is the failure in examination. Whenever it comes to the results of the CBSC, ICSC, ISC, or the NEET, UG, or the All India Triple E entrance examination, when it is not satisfactory, the students are attempting suicide. So we need to generate the awareness. So risk assessment is a very important skill. What is the most important indicator? The previous suicide attempt is the principal risk factor that the person once attempted in the past may attempt in future if the support system is not there. Family history of suicidal behavior, especially died by suicide, mental illness. We know in the depression, 15% of the people have the risk of committing suicide in unipolar depression, and the risk is around 25 to 50% when it comes to the case of a bipolar depression. In a patient who is admitted in the ICU and undergoing renal hemodialysis, renal replacement therapy, that person is having chance of around 40% of committing suicide. Other like the anxiety, traumatic brain injury. Most important two factors are concomitant substance use, being unmarried, divorced people, they are more at risk of attempting suicide. So what is the verbal clues? What are the changes that you will expect? So change in behavior, someone is giving away his precious possession. I have a very costly mobile phone. I am giving this to my friend, that keep it with you. This is one of the important signs. I am not feeling well. So 90% of people who will be attempting suicide, they will tell to their near and dear one within a span of 1 month, and 70% will tell within the 7 day span, 1 week span. So these are the very important for checking those things. and withdrawing from activity, the person having the and hedonia, the pleasure of doing activity, but now is expressing anhedonia, lack of pleasure. Hedon is considered to be the Greek god of pleasure. The person will don't have any interest to participate in previously enjoying hobby, social interaction, and emotional distress will be significant. So there are identifying SIBs, that is self-injurious behavior. It could be the suicidal or it could be parasuicidal. Previously, it is called as parasuicidal. There's now got non-suicidal, no intent to die. We encountered the young girls who are slashing their wrists repeatedly, and that could be a sign or harbinger of the emotional unstable personality disorder. But when the person having strong intent to die, the suicidal ideation, suicidal plan, and suicidal attempt, this goes in a sequencing manner. So genetic factor leading to the trait dependent factor, then state dependent factor, immediate plan, and immediate triggering event, a quarrel with the boyfriend or the girlfriend, of eventual dispute between a husband and wife, or eventually losing a huge amount of money in the gambling. This could be a triggering factor for suicide. So there are three C are extremely important to response to the risking factor. One is the connection, second is the collaboration, and third is the choice of alternative approaches. So there are different ways of treating by virtue of prescribing the strong antidepressant drug, or there are other methods like the electroconvulsive therapy and the repetitive transcranial magnetic. That are the biological treatment option, non-pharmacological biological treatment. So pharmacological option, there are plenty of medicine that can eventually revert back the. We also have find that an injection ketamine has been found to just revert the suicidal thoughts within a span of few days. But we have to go with concomitant psychotherapy as well, like cognitive behavioral therapy, dialectical behavioral therapy, as advised by the Marshall Linehan. In cognitive behavioral therapy, we have three negative. We're surrounded by three negative about self, environment, and future, which are leading to hopelessness, helplessness, and worthlessness. And Aaron T. Beck has advised these CBT strategies by challenging the alternate thoughts and alternate behavior. We can just change the mindset of the person. In the dialectical behavior therapy advised by the Marshall Line and very aptly introduced for the high suicidal impulsive behavior, as well as in the borderline or emotionally unstable personality disorder, there are four pillars of the DBT. One is the mindfulness training, second is the interpersonal effectiveness, three is the distress tolerance, and fourth one is the emotional dysregulation. So these are the four key components of the DBT. Psychodynamic therapy, group therapy are extremely important. When the group of people who have attempted suicide, they will discuss among why they are doing. The role of social media is important. We know that the Vincent van Gogh, was suffered from the bipolar disorder, and we had a film by Akira Kurosawa where we know that in the phases of the mania he used lots of colors, and in the phases of depression is a very gloomy, bleak and steam, and in those cases only black and white colors being used. So Instagram filters are extremely important. We are now using Facebook and Instagram filters, but there are certain leaders who have emerged up, like this Kevin Hine. Kevin Hine has expressed his story. The ending your life is never a solution. My purpose, sharing my story. So this is the positive aspects that media has to play. The social media's role is important. Recently, we have the chatbot, Weebot, and other artificial intelligence tool. But artificial intelligence cannot replace the human intelligence. So we have to take with this a pinch of salt. So these are the popular, the Werther effect, the sorrows of King Werther, and this has been depicted very importantly because with this Werther effect, even we have heard about the famous film stars when Robin Williams died, there had been 10% increase of the suicide within a span of next 3 months, and 30% of those suicidal attempts have been due to by hanging. So two most common methods used in India, number one is the hanging, and number two is by organophosphorus poisoning. So after this Werther effect, that is the celebrities committing suicide or sensationalizing the stories in the first page in the media, these are leading to the very detrimental effect, especially among the adolescents. In contrary, there is a Papageno effect, which is a protective effect, which is about the famous Papageno, the 18th century opera of the magic flute, when he was contemplating suicide, the other characters have prevented him to commit, and shows the alternate ways in life. In Bollywood movies, we also have seen lots of movies have been portrayed about the how to prevent this suicide. So there are biological marker of suicide. The serotonin and 5-HIA in catabolite in the midline raphe nucleus and hypothalamus reduce 5-hydroxyindolase in the prefrontal cortex have been found post-mortem when the person have been died due to the suicide. Now, what are the emergency care we can provide? In the emergency department, the transition phase, and outpatient provider. So, emergency, we need to give the support, the screening, measure, discharge planning, collaborative safety plan, and we have to keep a close observation and constant watch to the patient. Thereof, the transition phase, record sharing, communications, and the engagement with the support. We need this support system is extremely important. In India, only 14,000 mental health professionals are working day in and day out. Clinical psychologists around 8 to 10,000. Psychiatric social worker meagerly 5,000 in a population of 143 crores. So we need to build up. So in NMHS, we have found in every seventh Indian is suffering from some sort of mental disorder. So the mental health treatment gap is as high as 70 to 92% in our country. Outpatient provide is also extremely important to follow out. Now coming to the legal duty, there had been a criminalization process previously in IPC section 306 and 309. So 306 tells us that abatement to suicide, person assisting suicide. So like the mother-in-law or the sister-in-law constantly poking that you should die, you should die. So if the person committed suicide, so thereafter she writes down that my death is due to I have attempted this because of my this person. So that person will have been punished up to 10 years as a prison sentence. Previously, when an individual used to attempt the suicide, he or she has to be punished for 1 year with or without fine. So a person who is already being mentally traumatized, it is of no use that you will just put a fine on him or her for a rupees of one say for 1 year prison imprisonment and unnecessary police harassment. Thanks to the Mental Health Care Act of the Section 115, suicidal people are presumed to be suffering from mental health issues, and decriminalization of the suicide is extremely important step, welcome step, and we have abolished the Section 309 of the IPC. MSCA shows us lots of path. The MSCA decriminalizes attempted suicide. The legal change signifies a shift towards the mental health issue and the individual who will attempt suicide is no longer remain punishable under the criminal law. MSCA recommends the human rights and right to access for the healthcare services. It is the responsibility of the state to provide the proper mental health care and establishment of the mental health facility services and the various level of healthcare delivery up to the level of districts has been advised, and envision and protection of the human rights with dignity. Coming to the media ethics, there are lots of celebrities. I'm not going to name these individuals. You all know, and we have heard that their ending of their life has not been, though some have been remain disputed, but more often we have seen that media has sensationalized those celebrities in the front page stories. So it is an advisable that ethical reporting guidelines are extremely limited to safeguard the vulnerable population, and these guidelines are based on the substantiative research. Do not refer to suicide attempts as successful or failed attempt or committed. We should use the proper words. We should use attempted suicide, made an attempt to died by suicide like this, and use terminology that is not moralistic and better aligns suicide. It decreases the negative attitude to the mental health professional, and the sensationalization is absolutely prohibited. So everyone is just running before the TRP. This media, this news media, this print media, that electronic media, they're always hungry for the TRP. Inform the audience without sensationalizing the suicide. This means excluding to the degree possible images of the graphic depiction. Instead, focus on the live any mental health or general struggle they had been public about. And if the story is centered on firearms and bridges, care should be taken to describe how death occurs. The Golden Bridge, San Francisco, there is a famous place of that we also call is a suicide point. It's the hotspot of the suicide. So hotspot of the suicide is also being told as suicide contagion. For if in a geographical boundary, three or four suicides happens in a month, you will find eventually more suicide is happening over there because of the media is giving a negative impact. Prominence is extreme number. Do not feature the suicide story on front pages. Do not mention the word suicide or method in detailing. And prominent placement of the word suicide and method has been shown, leading to the contagion, or we call it as copycat suicide. So magnitude, do not refer the suicide as an epidemic or skyrocketing. When referencing suicide as a leading cause of the death, include most recent rates and suicide as a solvable and preventable public health issue. Hope and help needs to install everyone's and always provide helpline information. Celebrity suicide has to be dealt very, very carefully. We know that the many Bollywood superstars have committed suicide, and inadvertently glorifying the suicidal behavior is absolutely prohibited. And avoid speculation and the media trial on the event before coming to the actual thing. What happened? We call it the psychological autopsy, and the role of social media is immense in this case. So do not sensationalize, do not detail about the method that is used, do not name the individual who has done this, do not report the detailing method, do not oversimplify it, do not use the photograph, do not use the language or the content which sensationalizes and stigmatizes, and do not unduly repeat the story again and again. So psychological autopsy is the cause for the suicide. It has been a retrospectively we try to reconstruct the event, and autopsies are originally designed to investigate, clarify, and help the police to inquire about the mode of the death. And however, in recent years, they have become more often utilized as a research tool. So this is one of the important flow chart how we do the psychological autopsy, the genetic factor, traumatic experience, the trait dependent factor, and what is the eventual culminating event. But there are limitations of the psychological autopsy because lack of standardized technology, information bias could be there, lack of interviewer training, recall bias, issues with the control selections are there. So role of psychological autopsies, investigating a case of atypical suicide in schizophrenia is a modeled here, and we can see what are the different thing is that celebratory introverted personality, the secondary education, unemployment, minimal income, family struggle, divorce, having the other disease like schizophrenia, bipolar disorder, or the other comorbid substance use, any other medical condition like the type 2 diabetes, hypertension, dyslipidemia, chronic kidney disease, all could lead to triggering factor of the suicide. Now, just few more 1 or 2 minutes, I would like to what are the myths and facts. Why suicide happens without warning? So it is absolutely false. So suicide happens with warning. Suicide reveals that suicidal person will often give many clues and warnings regarding his or her suicide ideation. Second myth, once a person decides to complete suicide, there is nothing anyone can do to stop. Absolutely false, because suicide is the most preventable kind of death, and almost any positive action may save a life. Third myth is that confronting a person about suicide will only make them angry and increase the risk of suicide. Many of my physician colleagues are very afraid to ask this question. Are you suicidal? Do you have any suicidal thoughts? So we should always inquire. Asking someone directly about the suicide intent can lower the anxiety, open up communication, and lower the risk of impulsive attempt. Fourth myth is that there is a difference in suicidal behavior between boys and girls. So it is true. I have already mentioned the girls attempting suicide more often, 3:1 ratio. But completed suicide is more common in boys in 3:1, because boys or males do attempt the suicide in more violent and severe manner. Talking about suicide can plant the idea in the mind. It is absolutely false. So we have to inquire about the whether he or she is suicidal in every history taking by the clinician or the mental health professional, being the nursing professional, be the psychological social worker or clinical psychologist. It is imperative to ask the person that whether you are any suicidal thoughts are coming in your mind. Anyone can help a suicidal student. Yes, anyone. It is not required that a psychiatrist will be available in the bedside. Anyone, not just a mental professional, can help by engaging the student in accessing the appropriate resource. Teachers are very important too. We need to train the teachers as a first line of defense in helping at-risk student. So my last line to end up before signing off with this presentation, that suicide prevention needs more sunlight, candor, and unshamed conversation. Let's talk. The beginning should be from here. So together we'll definitely have this malady out of our mindset that suicide and the mental health are not surrounded by the stigma. We should not forget to bring the patient to the psychiatrist or the mental health professional as early as possible. What is the stigma? Why are going to consult or visit a psychiatrist or the mental health professional? So the sooner we'll do that, the better it will be for our patient. Thank you so much, the team IGCP. High regards to Dr. KK Agarwal, and thank you, Ada, for giving me this opportunity. So I'd have to get the questions, if any, being asked. Thank you. Over to you.
Yeah. Thank you so much, sir, for that powerful and thought provoking sessions. Your words remind us that mental health is not a stigma but a call to compassion. Now we will move to the Q&A session, and I encourage our audience to type questions in the chat. So I can see there is a first question. What are the most subtle early warning signs of suicidal thoughts that families and clinicians often overlook?
It could be different types, like for giving away the person's position, writing some diaries that they're giving the clues that I'm doing that, writing some messages in the social media that life is not worth living. So going with the tracking the person previously used to enjoy a lot of watching movies or going to watch a football match or in a conversation with the friends. So if the person abruptly stops that and eventually become homebound, and there had been a triggering factor of economic loss or breakup in relationship or family quarrel or the legal issues, we have to be very very careful that this person might have the chance of suicide. And as already mentioned, always ask and ask.
Okay, thank you so much for the answer, sir. I hope you did justice with the answer. So, the next question I can see is, how can primary care physicians play a stronger role in identifying patients at risk of suicide?
It is very important for the PCP, the primary care physician, because they are the backbone of our health system. So, in the district mental health program, the NMHP has been started in the year 1982 and DMHP from the 1996. So, now we train the medical officers who are working in the primary health centers. So, by training them, they are just screening. But I am very sorry to say that every MO or the BMO, block medical officer of health, they have lots of burden with the ongoing national programs. So mental health is a minuscule of them. So the if you have the health budget of the one bucket of water, just consider health budget of our country as a one bucket of water. So in the mental health, it is just few drops of water. So we need to concentrate about the generating awareness and training. So primary care physicians are the pillars, and the ratio of the psychiatrist and the mental health worker versus patient is around 1 in 1,000. So every 1,000 patient we have a one psychiatrist or mental health worker working. So we cannot get their opportunity to have that discussion. But the Telemanas Prakalpa is there. The government has started the Telemanas. So by doing this, we can do the online on teleconsultation with the specialist who will be sitting in the medical college or the Apex Institute, and the PCP. After screening the patients, they can discuss the common mental disorder and the severe mental disorder with the concerned specialist.
Okay, thank you so much for the answer, sir. And the next question I can see is, what strategies would you recommend to break the stigma around mental health in smaller towns and rural India?
So I am trying from the very beginning. I must confess you, Ada, when I become the psychiatrist, it has been already been stigmatized. So seeing the face of the psychiatrist will eventually lead to the you will having the bad times for the next 3 days. So if someone socialize with me in a party, they used to avoid me. So psychiatrist is such a fearful person. So psychiatry has been stigmatized from the very beginning. We need to break the stigma because of awareness. I must tell you here that of my 23 years of clinical practice experience, the stigma is more common with educated people. It is not so with the so much not well to do or the person who are coming from the remote villages. They are more keen to consult us, and they follow our advice. When it comes to the civilized society, they often feel stigmatized of taking the medicine. So if you have your cell phone in your hand and just tell that you are the best mobile phone in the market, get fully charged, I am doing counseling, it is not going to get charged. So because we need the biological treatment, if you just put it in the plug in with a charger, the mobile phone will get charged. Similarly, when in our brain, just look at this model, this is our brain. So when there are serotonin, dopamine, and norepinephrine imbalance over there, so reduced serotonin will be leading to the depression. Norepinephrine from the locus coeruleus will lead to the increased secretion of the adrenal epinephrine from adrenal medulla, which will lead to the anxiety. And dopamine is a very important from the ventral tegmental area to the nucleus accumbens, going to the frontal part of the brain, that is prefrontal cortex. This is very important monoamine. So things have changed a lot. So there are attentional network, central executive network, default mode network, Salience network. We can modulate that. So I will be love to see in my lifetime that one day will come when I will put a chip in your brain, Ada, and with my Wi-Fi network or with my Bluetooth, I can adjust the serotonin, dopamine, and norepinephrine. So breaking the barrier of stigma is the most important challenge, and together we have to do that. All stakeholders, mental health professionals, general people, and the media people, like this, the Med Talks are doing. The team Med Talks are generating awareness on a very auspicious day, the World Suicide Prevention Day. The audience, whoever, whatever the minuscule size, I don't know, whoever the watching, they will spread this message to the other people. So by passing this baton like a marathon run, we can generate the awareness and break the barriers of stigma.
Okay, thank you so much, sir. How beautifully you replied and explained this topic, sir. And so the next question is, in your experience, what immediate step should be taken when a patient openly expresses suicidal thoughts, sir?
As I mentioned, the psychological first aid PFA is very important. Second one is in every suicidal attempt or every suicidal talk has to be given the due weightage. So, if necessary, the team should be there. And we, as I mentioned, the emergency workup, the patient will be shifted to a in between midway, halfway we call it, and thereafter the OPD based treatment. UK and US, there are teams available, so they will visit the psychiatric social worker team, visits household to inquire. But in our country, it is minuscule. As we mentioned, that 143 crore population is not prudent for visiting every household who have attempted that. But I think that one important part, the person has to be discharged in a proper manner. So it is too early discharge may increase the risk of suicide. Remember that whenever you will give a medicine for initial 3 weeks, it is not going to work. So all the SSRI group of medicine we prescribe, it takes 3 to 6 weeks for work. So initial 3 to 6 weeks, we have to keep a very constant watch to the patient, and also the supportive psychotherapy, cognitive behavioral therapy needs to continue to go on at least 3 days a week for at least for next 6 months to 1 year, and the session should last for 45 minutes. Initially the opening up, there are the breaking the ice, and the person will just tell their own feelings. And by doing the guided psychotherapy and the combined pharmacotherapy, powerful medical treatment options are there. And don't forget about the side effects of the medicine. So cost of no treatment, cost of impartial treatment, cost of inadequate treatment are much higher than the side effect of the medicine. So don't get bothered about this primitive thinking, the side effect, side effect, side effect. There are plenty of newer drugs are available. These are very, very absolutely safe and practically side effectless. The thing is that you need to be a stigma. You come to the specialist, and the specialist will advise you and he will guide you how to make a comprehensive plan.
Okay. Thank you so much for the answer, sir. I hope you did justice with all the answers, sir. So, with all your permission, I'm going to conclude this session. And as we mark World Suicide Prevention Day, today's session stands as a reminder that together we can break the silence. On behalf of Med Talks and IGCP, I extend our heartfelt gratitude to Dr. Ranjan Bhattacharya for sharing his expertise and to all our participants for engaging in this critical conversation. Let us carry forward for today's message that even a single conversation can save a life. So, with all your permission, I'm going to conclude this session, sir. Thank you and good work.
Together we definitely can and change the narrative of suicide. Please.
Yes. Yeah. Thank you, sir.